Hello everyone and welcome to this session of the AI Nurses Network webinar series. Today we have a great nurse with us, Lene from the University of Agder in Norway, who's going to talk to us about some work she's doing around AI for nursing documentation. So over to you, Lene.
Thank you, and thank you for inviting me. As Siobhán said, my name is Lene Laukvik, and I have been invited to talk about AI in nursing, but more particular in nursing documentation. The talk is based on two projects we have been working on. One is finished and one is in progress. And I have named this webinar session as Bridging Satisfaction and System Gaps Towards Trustworthy AI in Nursing Documentation. Just to say a little bit more about me and where I am, I work as an associate professor at the University of Agder in the south of Norway in the Department of Health and Nursing Science. I'm located in Grimstad, which is one of our two campuses. I completed my bachelor's degree in nursing in 1996, and my clinical experience spans nearly 2 decades, including work in both hospital and municipal healthcare settings. In 2011, my career took a new direction towards education. I began teaching healthcare professionals, starting with nursing assistant students in 2013 at, I think, sixth form or college level in a British context, which might be comparable to high school level in the US, I think. In 2016, I joined the University of Agder, where I currently work as a researcher, supervisor, and educator across all levels in nursing education, bachelor, master's, and PhD level. I'm also a member of Center of eHealth at the university, which is an interdisciplinary research group. And my research topics focus on nursing documentation and the use of standardized terminology in electronic healthcare records, particularly within municipal healthcare settings. I'm especially interested in how eHealth solutions and AI can support better documentation practices, improve quality of care, and maybe enhance decision-making in nursing. To give you a little bit of context for my talk, and a little bit about the Norwegian Municipal Healthcare Service. Nearly all municipalities in Norway have an allocation office staffed by healthcare professionals, which plays a vital role in prioritizing healthcare services by managing the distribution of resources across competing needs. Allocation offices collaborate closely with home healthcare nurses concerning the coordination of services in the municipality. The effectiveness of these offices depends heavily on well-structured and up-to-date information in EHRs, which enables informed decision-making and ensures that resource allocation aligns with policy priorities and the expectations of the citizens. In home healthcare, the mobile nature of the work complicates the high-quality documentation and workflow. Nurses frequently provide care on the move, making it difficult to document care efficiently during or immediately after patient visits. Healthcare professionals, and in particular nurses in municipal healthcare, face escalating expectations to conduct comprehensive assessments, evaluations, and documentation for care coordination. In particular, EHR systems have been identified as a major barrier to effective information flow and streamlined clinical workflows. Additionally, current practices are often hampered by fragmented access to information and challenges related to secondary use of information or data. Simultaneously, there is a mounting pressure to enhance workflow efficiency without compromising the quality of care, while also accelerating the development and implementation of digital applications, such as AI. Norwegian authorities propose that tasks in the healthcare services where personnel do not have direct contact with patients or relatives should be automated to the greatest possible extent. AI, including text-based approaches such as large language models and personalized medicines, are examples of approaches intended to support this transformation by assisting healthcare professionals with documentation-related tasks. However, although AI can offer great opportunities in healthcare, it also carries risks that can build skepticism among healthcare professionals about the reliability and appropriateness of such technologies. This skepticism can reduce the likelihood of adoption and lead to difficulties in scaling up AI-related projects. The Norwegian Research Council announces funding through the Pilot Health Programme for ambitious innovation initiatives aimed at increasing sustainability in health and care services, while also driving value creation in the Norwegian health industry. Projects in this program must be based on clearly identified and documented needs within specialist and/or municipal health care services. The project must also have a high likelihood of national and international implementation and scaling of the solutions developed in the project. A key principle in Pilot Health is that no single actor can solve these challenges alone. Projects must therefore be built as committed collaborations across public and private sector, ensuring that the user perspectives is meaningfully integrated. Such projects must also include R&D activities. So in 2024, we started the progress of applying for funding in Pilot Health Program by establishing a consortium together with Grimstad and Arendal Municipality in the south of Norway, Amilan, which is a technological company, the National Center for eHealth Research in Tromsø, Norway, and the University of Agder, and Center of eHealth, of course. In this program or in these applications, R&D institutions are not allowed to apply as project leaders, but are more sort of procured part of the project. We are 100% funded from the Research Council to do the research. Excuse me, I'm just going to go further. Pilot Health is a two-step application, and in December 2024, we received funding on 240,000 Norwegian kroner for a pre-project to establish the cooperation, map overall readiness in the municipalities for AI implementation, and work on our main application. And in December 2025, we received funding for the main project, which was 17.4 million Norwegian kroner. And we had a kickoff for this project now this May in 2026. So we just started with this. So I would first give you a walkthrough to our pre-project, which was finished in spring 2025. The purpose of this study was to conduct a needs assessment for a co-creation of knowledge to use AI to reduce documentation burden and increase information accuracy during documentation and coordination processes in Norwegian municipal healthcare. This study builds upon a socio-technical system perspective. We collected insights from 3 participatory workshops conducted during the spring of 2025. 10 key stakeholders participated, including healthcare professionals, case managers, ICT personnel, and legal experts. All participants worked daily with information exchange and coordination of care in the municipal healthcare sector. Our data was analyzed using thematic analysis by Brown and Clark. So 3 main themes were developed through this analyzing process. The first theme was about satisfaction with current work processes. The participants experienced that existing guidelines, protocols, and collaborative routines was easy to follow. Timely information was received appropriately when the system was functional, but that was not always so, according to our participants. And they also mentioned and agreed on some barriers in digital systems. They expressed a strong need for system integration and AI information management to overcome the challenges of fragmentation, time pressure, and inconsistent data transfer, which often resulted in delays or incomplete data transfer. Usability concerns were mentioned because they often led to time spent on routine tasks. The third theme reflected the optimism for system development and innovation within e-health, and a shared enthusiasm and belief that AI could significantly enhance patient safety and workflow efficiency. The potential role of AI in addressing these issues by summarizing, filtering, and standardizing information was a recurring desire. There was a clear focus on reducing manual work processes, increasing precision in communication, and ensuring that systems better support the daily needs of healthcare professionals. Despite the enthusiasm, the participants was also concerned about ethical and legal issues concerning AI. So in conclusion, AI-supported documentation in nursing is perceived as a promising approach to reduce documentation burden and improve information quality in municipal healthcare. This needs assessment highlights the importance of addressing socio-technical factors, particularly system integration, usability, and trust, to support the successful adoption of AI solutions in nursing documentation and care coordination. I will now talk about time to care, AI supported nursing documentation in Norwegian municipalities, which is our main project and is, of course, as I have stated, work in progress. So I will tell you about our plans. Our main goal is to develop and implement safe AI-based tools, technologies that support healthcare professionals in documentation and coordination processes, reducing time spent on documentation, improving data quality, enhancing accessibility, and strengthening interoperability across municipal healthcare services. The project is structured into 4 iterative steps that gradually introduces AI-based functionalities, starting with mature technologies and progressing towards more complex, less established capabilities. This incremental approach is designed to match increasing levels of technical, organizational, and regulatory maturity and complexity. We believe that this staged approach enables early value creation through speech-based tools that are ready for use in practice, while allowing time to co-develop and safely integrate more advanced features in close collaboration with our users. The iterative design supports continuous learning, real-world validation, and structured adaptation to the nursing context, ensuring that both technology and work practices evolve in steps. Nurses and caseworkers in the municipalities will actively contribute in all phases of the project, defining functional requirements and ensuring that the SRT models and AI applications reflect actual workflows and documentation needs in municipal practice. Moreover, the users will be involved in iterative testing of the applications in real-life scenarios, with a focus on usability, professional relevance, and seamless integration with existing systems. Their feedback will be systematically collected. The consortium will also ensure user involvement in co-design processes by establishing an advisory group that will remain active throughout the project life cycle. Time to care is structured into 6 work packages linked to main activities. The work packages build on each other and will have parallel processes. We have 5 central milestones. First of all, pilot implementation of the SRT, and this marks the first major deployment of SRT with ambient scribe, providing early insights into its functionality and impact in real-world municipal setting. Secondly, AI application and domain adoption, developing and adapting the AI solution to the specific needs and context for municipal healthcare services will be central in this milestone. Thirdly, pilot implementation of the AI application. The AI solution will be tested in practice, allowing for evaluation of its performance, integration, and user experience. And of course, insights and lessons learned from the pilot implementations will be documented and shared, supporting knowledge transfer and broader sector engagement. And finally, a strategic plan will be developed to guide the commercialization and scaling of the solution aligned with Norwegian and Nordic health IT markets. So hopefully you have gained some new, maybe, insights or ideas on how we can bridge satisfaction in the healthcare professionals and systems so that we can move forward toward trustworthy AI in nursing documentation. These are my contacts for conversations, reflections, and discussions in AI in nursing, and in particular nursing documentation processes. I would be happy to talk to you. Thank you so much for inviting me.
Oh, that's great, Lene. Thanks. That's really interesting, and it's nice to see that there's AI research in nursing happening in Norway. I was just really curious, as a nurse, how did you get interested in this area? Is it something that was going on within your university or other colleagues?
No, I got interested in, I think it was through my research actually, because in my PhD, I focused on nursing documentation processes and standardized terminology. And there I understood as the PhD project went along that there is something about this standardization and the AI, how we can build AIs and in nursing. So, of course, when I started my PhD, it was in 2018, and that was before AI became revealed for the world, although AI, of course, have existed for several years before that. When that came up, I think it's just popped up some ideas that, oh, yeah, here we have a path to follow on the standardization line, if you
Great.
understand what I mean.
I do, yeah, great. And do you have any advice for maybe nurses who are maybe interested in this area, what they could do to get involved and learn a bit about AI?
Yeah, I think that first of all, that is very important because nurses are seldom involved in these projects. And I know that you have done some research on this yourself. So this is, I think that nurses need to, first of all, take a place at the table. Just grab a chair, sit down, talk about it. And I think it's also important for nurses to learn something about the concepts of AI technology, because I have, of course, it's because I've been reading a lot and trying to understand the concepts. I'm not a technologist. I can not program or do any technical part of this, but I can understand the language when I talk to technologists and scientists and engineers, data engineers. So that have been important for me to sort of get a foot in and also get understanding for the nursing context, because not so many people understand nursing context, although they have trust in us and they think we're great workers and we do good jobs and then we take good care of health for people's health. I don't think they know actually how we work and how our workflow function. So I think that would be important for nurses to go out, talk about it, make contact, understand this world of AI before we go further. Mm.
Yeah, there's definitely lots of jargon that you'll come across that can be hard to get to grips with, but just like medical jargon, a little bit of understanding will take you a long way. So that's really good advice. Thank you. My last question is kind of a difficult one, but something everyone is probably wondering, where do you think AI might go in the future and what trends should nurses be kind of looking out for in relation to AI in nursing?
I When we think about how AI will go in the future, that is hard to kind of answer because not AI, but the people with the money and the companies and the ones creating AI take them in many ways that not everyone can control. But if we can do that, I think would be important for nurses to be aware about the ethics concerning AI. I think it would be important to maybe that AI, we can look at AI as an assistant, a support, not something that we can just give a task and here you go, take it, do it. So when it comes to trends and apps, I am slightly a past technologic optimist, I think. I think we can do great things when it comes to take away the administrative burden of nurses, to help us have more patient contact, develop our profession. So when it comes to administrative tasks, I think absolutely go for it. I also think that predictive models can help us in some way as a support. But you need good nursing data. And per now, the nursing data is not that good, not so good quality. Yeah.
Yeah, I agree. We have lots of gaps in nursing data sets that don't exist at all, or there's gaps in the ones we do have, which sometimes aren't great quality either. So there's lots of work to be done there. Well, thanks so much for your presentation. It'd be great to check back in a year or two and see how the main project is progressing, because I really liked that you're starting with maybe the current sort of AI tools, and then you have a plan for looking at the more sophisticated versions kind of once the initial ones are embedded. So yeah, it'd be great to check back in a while and see how you're getting on.
Yeah, I'm looking forward to we get some data and we can see something. We are currently doing our first sub-study of we're doing an observation study in home healthcare and the allocation offices, just to map needs and workflow actually.
Fantastic.
So that's interesting.
Yeah, great. Sounds like lots of fun. Lovely. Well, lovely to meet you, Lene, and yeah, we'll touch base again in a 12 months' time. Thank you so much.
Absolutely.